Hi, my name's Haley, and I'm going to be doing an assessment on your skin, hair, nails, lymph, head, neck, eyes, ears, nose, and throat today. Does that sound okay with you?
Yes.
Okay. So we're going to begin our assessment. We're going to start first with an ear exam. So basically what I would do if I had the instrument is I would take my otoscope and I would lean it towards facing the ceiling. So I would stand up and then I would lean towards facing the ceiling, inspect your ear canal and make sure your tympanic membrane is looking okay. What that means is the ear canal is clear, there's no redness, no swelling, no discharge, stuff like that. And then in the tympanic membrane, it's going to be this pearly, gray, and shiny. It's intact, and the landmarks is like a light of the cone. So that would be the first assessment that I would do. Make sure everything's good. I would check both ears. Next would be an ophthalmoscope. And this would be looking at your eyes, looking at the retina, the optic disc, stuff like that. So I would just shine this bright light into your eyes. So for instance, this is a brighter light than what we would actually do, but I would shine it just to see if you have any reaction. We would look for the red reflex. The optic disc is a yellow, orange, pink, well-defined margins. And then the cup to disc ratio is generally less than 0.5. And then we would do your perla. So I would just shine this light, see what your reflexes are in your eyes. And I would say you're about a 3 in each of those eyes, which is normal. And perla would be yes. Then I would come behind you for your lymph assessment. And I would just palpate and make sure everything's soft, nothing's swollen, and we're good in that aspect. And then I would just do my typical assessment with my stethoscope, and I would listen to your heart. I would listen to S1, S2, see if there's any murmurs. I would listen to your lungs, and I would just do 4. I typically like to listen on the back, but you can listen on the front as well. We listen 1, 2, 3, 4, 5, and you would be clear bilaterally, no wheezes, no rhonchi, nothing like that. As for your abdomen, I would listen to each bowel or each quadrant of your bowel for about 5 to 30 seconds, depending on obviously what you come in with. If we're having issues with motility and all that stuff, I would listen probably for about a minute a piece in each quadrant, make sure everything's moving in each of those quadrants. So I would start here, and then I would go up to the right and down. And then we would assess just your vision on the Snellen eye chart. So you would look forward and you would read me down on the furthest line down, reading from left to right, what those letters would be, covering one eye, covering the other eye, and then covering or opening both eyes to see what your findings would be. Normal would be 20/20 vision, meaning the patient is seeing at 20 feet what a normal person would see at 20 feet. And then for tape measure, I would actually do physical measurements, measuring the size and growth and swelling of something. As for symmetry between body parts like your limbs, measuring appropriate for age and sex. This is more so for children, but we would just go feet and up for that. Making sure there's no enlargement, no edema, no abdominal distension. The tuning fork, hearing, and neuro tests. This is what I would do to assess for vibration and stuff like that. What it does is it's testing hearing and vibration sense. We can use the Rene test. It's air conduction and bone conduction equals normal. And then there's the Weber test. Sound is hearing equally in both ears, no lateralization. And then the vibration is more like a neurologic thing. So a patient can be, we would put it on like their fingers and toes and just kind of see if you're having any numbness or tingling, or if you can feel each poke that I poke on the bottom of your foot. So typically would have you lay down and then we would poke each part of your foot. We do this a lot of the times for like diabetic patients to see if they have any kind of neuropathies. And then have you been having any skin issues, any moles that you are worried about or anything like that?
No, not at this time.
Okay. Any thinning of your hair?
No.
Okay. And then you're wearing your UV protection while you're in the sun?
Yes.
Okay. Other than that, we would just basically go off of what your concerns are for today. But other than that, we did our assessment of everything that we needed to. Do you have any other questions for me?
No, I'm good.
All right, thank you.
Thank you.